when we got the initial diagnosis that Alwena had cancer, it's obviously a shock to absolutely everyone, because everyone I can imagine that's diagnosed with cancer almost thinks that's the end of life. You know, you drop the C word and people just go to ground. We were approached on the ward, and the consultant that came in with his team, his entourage, looked at Alwena and said, "It's cancer." He then turned round and walked out of the room, closely followed by the rest of his team. At that point, I decided that I would leave the room and chase them down the corridor and ask them to come back into the room and explain exactly what type of cancer it was, what was going on, and just to try and seek some more information from them. It would certainly have been easier if someone had come along, explained it a little bit more subtly, and we would have been given maybe like a liaison type nurse or someone that we could actually go to, because at that point you've got 1,000,001 questions going through your head, none of which you can actually get out because you're in total shock. The support and communication could certainly be improved the minute the patient has been given the diagnosis. At that point, family support needs to be organised, maybe sort of social work type support from the hospital. Social workers could maybe come on board. Certainly the clinicians need to give thorough explanations of what is going on, what's going to happen in the interim period while we're waiting to get you to an oncology appointment, and just general all-round healthcare support for that patient. And I think that seriously lacks. The minute you mention the word hospice, they feel that they've come to the complete end of their journey, where in fact they actually haven't. The hospice are very much set up there to support you through your journey. So your main areas of information really come from the oncology nurses and the hospice team. And as I say, from my perspective, I actually dreaded our first referral to hospice. But knowing what I know now, I feel that a really good early intervention and that type of support for patients, families, caregivers, whatever, is crucial. I'd like to see a model whereby dedicated staff are there for that patient whilst they are on a general surgical medical ward, because once you've answered the question, you know, that patient slept on it overnight, woken up in the morning, and there's 1,000,001 other questions that they need answering. So dedicated staff that maybe can just support you on that 2-3 week wait before you're referred to oncology departments. She doesn't qualify for an intensive care bed. The reason she didn't qualify for an intensive care bed was because she had stage 4 cancer. At best, we can give her a high dependency unit bed, and she went onto the high dependency unit, where she stayed for 5 hours. HDU became incredibly busy because something had happened, some major incident, and Alwena was then put back onto the ward. Most patients would have had at least 48 hours on a ventilator. She went back onto a general surgical ward. And we stayed on that general surgical ward and were very, very well looked after by the staff. They look at the subcut lines and they go, terminal. So I actually requested that they removed the subcut lines and started to administer her drugs intravenously, which they did, and remarkable how the attitude of the staff completely changed on the next shift. She wasn't seen as a terminal cancer patient. She was seen as a patient. We were very well looked after by our local oncology department, and certainly the nurses there were absolutely amazing. Community nurses were fantastic, that used to come out and sort of, do wound dressings and changes, etc., etc. Positive support from the hospice team was probably the biggest high on the whole journey. Alwena used to get a lot of comfort from going there and knowing that she was in a very safe, nurtured, caring environment, very, very well looked after by the staff there. If there's one legacy that she could leave, I feel it would be to make a few changes within the system so that other people that are travelling this journey as we speak today and will be travelling it tomorrow are made more aware of what's out there for them, what's available for them, given options and clear information, maybe not even in medical speak, just bring it down to basics and give people the option to come back the next day and ask questions. And if we could make just one change within the whole system, then her battle certainly wouldn't have been for nothing.